Hi, welcome to Eduvis Academy's YouTube channel. Eduvis Academy is providing classes for nurses who are preparing for licensing exams like Prometric Dha Haad and DHA. It's an online application program. It includes theory classes, exam-based theory classes, which is a 35 hours online class. In addition to that, we have questions, question discussions, mock test and exam mode practice test. So basically, one of the most important feature of our app is that you can watch the classes at your own convenient time. So with all these facilities, we can assure you that you can clear your exams easily. Okay. So let's start our question discussion session. And before starting that, one more thing we would like to remember you. If you like this video, please like, share and subscribe. Okay. So let's start the question discussion. The mother was coming to give her baby vaccination. Then she asked the nurse about her baby, that he has chronic constipation and defecate ribbon-like stool. The stool after pass is bad smell. Which of the following questions should the nurse ask the mother? So here mother has come to give her baby vaccination, and what is the problem actually? Baby has chronic constipation and defecate ribbon-like stool. Okay, the stool after passing is bad smell. So here the point of focus is that baby is passing ribbon-like stool, which is seen in a birth defect known as Hirschsprung's disease or a ganglionic megacolon. In Hirschsprung disease, what happens is that ganglionic cells will be absent. Ganglionic cells means nerve cells from which the nerves are developed. So it occurs mostly, especially in the lower segment of the large intestine, which is sigmoid colon and rectum. In that area, the ganglionic cells will be absent, leading to absence of nerves in that area, resulting in absence of peristalsis. So because of absence of peristalsis, the stool which comes from the upper segment will come and accumulate in the area where these ganglionic cells are absent, resulting in the distension of colon, which is known as a ganglionic megacolon. And one of the most characteristic feature of the Hirschsprung disease is that the baby will be having constipation, and first sign is known as meconium ileus. Meconium ileus means absence of meconium. Failure to pass meconium is known as meconium ileus. So here in the question it is mentioned that baby is passing ribbon like stool. So once we suspect the baby is having Hirschsprung disease, and once we see that baby is not passing meconium, digital examination will be done, and when you do the digital examination, the baby will pass flatus followed by stool, which looks like ribbon, which the characteristic feature is that ribbon like stool. So we have to understand that ribbon like stool is seen in Hirschsprung's disease. So now if you look at the options, which of the following questions should the nurse ask the mother? First, what are the fluid that is providing to your baby this week? Second, what is the fiber diet you give to your baby? C, have your baby delayed passing meconium after delivery? And how long have been this problem? These are the 4 questions. Out of these 4 questions, the option, if you see, just like I mentioned earlier, one of the characteristic feature is passage of ribbon like stool, but the initial sign of a baby with Hirschsprung's disease is meconium ileus, which is failure to pass meconium. So if you see the questions options, what are the fluid providing to your baby? What is the fiber diet that you give to your baby? Have your baby delayed passing meconium after delivery? So this question is connected to ribbon like stool, which is seen in Hirschsprung's disease or a ganglionic megacolon. So answer is option C. Okay, let's see the next question. The nurse reviews a client's electrolyte lab report and notes that potassium level is 2.5 milli equivalent per liter. Which patterns should the nurse watch for on the electrocardiogram as a result of the laboratory value? Select all that apply. Okay, so potassium imbalance causes, main function of potassium is it helps in the contraction of cardiac muscles. So whenever the imbalance in potassium occurs, it affects the cardiac contraction, resulting in arrhythmias. So there are two main imbalances, which is hyperkalemia and hypokalemia. Here potassium level is 2.5 milliequivalent per liter, and the normal level of potassium in the blood is 3.5 to 5 milliequivalent per liter. So 2.5 milliequivalent per liter means hypokalemia. So what changes occurs, what ECG change occurs in hypokalemia? That is the question. Options are U waves, absent P waves, inverted T waves, depressed ST segment, and widened QR complex. So here it is mentioned that select all that apply. Okay. So in hypokalemia, in potassium imbalance, the main change occurs in the T waves. In hypokalemia, T waves will be inverted and there will be prominent U waves. See, you can remember the defect, remember the change by seeing the term. Hypo means decreased, hyper means increased. So in hypokalemia, T waves will be decreased, which goes down, which is known as inverted T wave and prominent U wave. In hyperkalemia, hyper means increased, the T waves will be increased. The feature we see in ECG is tall T waves and wide QRS complex, right. So this is the normal ECG and the imbalance in potassium. So this is normal QRS and T wave. In hypokalemia, there will be T wave inversion, which is known as ST depression or T inversion, and there will be prominent U wave, right. In hyperkalemia, there is widened QRS, this is widened QRS, and the T wave becomes stalled. Okay. So if you see the options, the question is that select all that apply. So there might be more than one answer. Okay. So we said in hypokalemia there will be prominent U waves and inverted T waves, right, and there will also be depressed ST segment. So there are three answers. Whenever the questions comes like this, select all that apply, you should look for more than one answers. Okay. So here answers are option A U waves, C inverted T waves, and depressed ST segment. A, C and D are the right answers. Next question. A soldier was brought to the triage area after being exposed to chemical weapons. Signs and symptoms of nerve gas exposure were noticed. A nurse prepares for medical management. Which medication should the nurse prepare for the patient? So here a soldier is brought to the triage area after exposure to chemical weapons, and the symptoms indicate that the soldier has been exposed to nerve gas. Okay. Once a person gets exposed to nerve gas, what happens is that the secretions inside the body will increase, mostly seen as excessive tears. Okay. So question is, which medication, what is the antidote for this chemical weapons or nerve gas exposure? Options are A atropine, B adrenaline, C sodium nitrate, and D sodium thiosulfate. So the antidote given for the patients with chemical exposure to chemical weapons or nerve gas is atropine sulfate, which decreases the production of secretions, thereby decreasing the tears. Okay. So answer is atropine sulfate. Antidote for chemical weapons or nerve gas is atropine. Next question. Nurse was providing research study for 200 people. The research is answered by 120 people only. Calculate how many people that shared in study in percentage. So out of 200 members, only 120 people answered. So question is about the percentage of people who attended the survey or research. So it's a simple question. Options are 20%, B 40%, C 80%, and D 60%. So out of 200, 120 people answered. So we have to check that in percentage. So into 100. Okay. So if you cut these two zeros, 120 by 2, which is 60%. So this is the answer. Out of 200 members, 120 answered. So how much percent, to see how much percent we should multiply it with 100. and if you cut the zeros, it will become 120 divided by 2, which is 60%. Okay. Next question. Nurse is receiving a child post-operative tonsillectomy. Which of the following nursing action is suitable for the post-operative care? So here scenario is post-tonsillectomy. So which of the following nursing action is suitable for the post-operative care? Options are: encourage the child to cough spontaneously, observe for subtle signs of hemorrhage, place the child in prone position, suction the mouth to clear the airway. So surgery is tonsillectomy. That is the main point we have to remember. If you see option A, encourage the child to cough spontaneously. If you encourage the child to cough spontaneously, it will cause pressure on the surgical site and may causes bleeding. Okay. So option A is wrong. If you see option C, place the child in prone position. The main problem the child will have is airway problem. So after tonsillectomy, the position which you provide is semi-Fowler's position, not prone position. That will also apply pressure to the neck region and causing further complications. And B, also suction the mouth to clear the airway. One of the things which is contraindicated in a patient with tonsillectomy is suctioning the airway. Suctioning and throat clearing will cause damage to the surgical site and cause further bleeding. So the right answer is observe for subtle signs of hemorrhage. So one of the main assessment after tonsillectomy is to check for bleeding. How should we assess the signs of hemorrhage? One of the symptom is frequent swallowing. So frequent swallowing, if the patient is frequently swallowing, it indicates that blood is coming from the surgical site, and that's why patient is frequently swallowing. So observe for subtle signs of hemorrhage, which is by assessing the patient for frequent swallowing.